And just like with chemotherapy, there's a wide array of treatment goals that you have to look at. Most people want to go for the cure, obviously. It's not the case for everybody, but in a curative situation, we're dealing with early stage cancer where it hasn't spread beyond the regional lymph nodes to distant organs or bones. The goal is to eradicate every cancer cell there, basically slash and burn, burn the area all around the tumor and the tumor itself. And they're gonna allow for a higher dose of radiation for a higher amount of time and more treatments, and with the goal to cure. So they're willing to sacrifice some of the short-term quality of life to really try to prevent that cancer from coming back later. Now, in my case, it didn't work, but I couldn't have lived with myself if I just decided to do easy radiation and then it came back anyway. It's certainly something that I'm glad that I did, glad I tried it, and most cancer patients that walk that path probably say the same. In other cases, the goal is to control growth or spread of the cancer for a period of time without symptoms. So this is going to be something like a slower growing cancer of the prostate, metastatic to bone, for example. So metastatic breast cancer and prostate cancer to bone can be very painful. So they, in many cases, will use radiation in those particular areas to alleviate the pain. And they do it at a much smaller dose to not run into a maximum radiation dose over their lifetime anyway, because there's actually a maximum dose that every individual can have of radiation in their life. So you don't want to encounter that if you're dealing with a chronic cancer or a stage 4 cancer scenario. And of course, the goal is to control that cancer over a long period of time. And the last is palliation. So this is palliative care. Again, most often used in the stage 4, the metastatic environment, where the goal is not to cure. The goal is to relieve symptoms and improve quality of life. So we're talking like a very large liver tumor that's creating ascites or fluid in the abdomen for a lung cancer patient or a breast cancer patient. And the idea is, the patient's in a lot of pain, or there's a lot of side effects that they're experiencing. So let's go ahead and get a couple doses of radiation to try to stop that aggressive cancer growth. Maybe the cancer's not responding to chemotherapy or systemic therapy, and it's in some cases it's a last-ditch effort to provide some quality of life to that individual.